A new Axios Ipsos poll shows the pause on the Johnson & Johnson shot may not be having an impact on vaccine hesitancy as first feared. Right now, 20% say they won't get the vaccine, but that number has remained steady since January. Let's bring in Dr. Bob Lahita. He's the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Bob, good to see you. I feel like you haven't been with us in a little bit. We missed you. Good morning. Now, we heard from much of the medical community, doctors like yourself who are friends of the show, who were worried that this small risk of blood clots did not outweigh the potential dent this could make in public confidence about getting any shot in general. But those numbers seem to show that that might not be the case. Did you expect that this J&J pause would have an impact on vaccine hesitancy? And how do you feel about that stat?
I think the stat's great. Number one, I felt that hesitancy was going to increase as a result of the J&J clot controversy. Even though it was exceedingly rare, I heard from many patients saying, see, I told you so, doctor. I don't want the vaccine. I'll wait 2 years to see how the numbers pan out, Savannah.
Wow. And so you've actually been hearing that. Do you think that depending on what happens with the CDC meeting tomorrow and these next steps for Johnson & Johnson and vaccine, will that help with people that you're actually seeing, patients, depending on what we hear?
Yes, I think it's ultimately going to help because we have taken great pains to explain the whole rarity of the blood clots with regard to both AstraZeneca and the J&J vaccine. But as you know, the J&J vaccine is available here or will be available here in the United States. And so, yes, we have to explain to those people who are on the fringe and may not get the vaccine because they're frightened. We have to tell them that there is no reason to be frightened. The vaccine is perfectly safe. And that's very important to transmit that information.
That is such an important message. Dr. Lahita, quickly before you go, I do want to ask you about the fact that COVID cases are rising in children. We know some vaccine trials are beginning on children as young as 6 months. What do you make of this rise, and when could we see kids get vaccinated?
No, it's very disconcerting. We want children to be vaccinated as soon as possible. There are 88,500 new cases last week, up 5% in children. Now, children rarely get severe symptoms, rarely die, but they do die. There are certain kids, for some reason, that get this infection very severely. And we want the 17, 18-year-olds in high school to get vaccinated. We understand there are high schools that are giving the vaccine, and with parental consent. It is extremely important to have that small population of the people of small age to get injected with the vaccine.
Dr. Lahita, with a lot of great vaccine information there, as always. So good to see you. Thank you so much.
Good to see you, Savannah. Thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.